This is the first of a two-part series discussing the Plants for Joints trial to evaluate whether a healthy, whole food, plant-based diet could reverse rheumatoid arthritis and osteoarthritis. Before we get into the interview with Dr. Schaardenburg, we have a translated interview from the Plants for Joints trial. One of the subjects shares the benefit of changing his diet and lifestyle had on his rheumatoid arthritis. Remember that while I am a doctor, I am not your doctor. All of your signs and symptoms should be discussed with your physician. And now on to this week's episode.
How are you doing before entering the Plants for Joints trial?
Walking up the stairs was no longer possible. Standing up from the couch was not possible because my knees were inflamed. I couldn't put on a jacket. I needed help putting on socks. All those simple things were no longer possible. And the excruciating pain, at some point you feel hopeless. You get depressed, even though I'm not really like that. You keep going one step further. You see less escape routes to get better. And at some point you become desperate. And it's not good to get to that stage as a person.
Is the transition to eating a plant-based diet hard?
I always liked fast food. A croquet or sausage was a yummy snack. My diet consisted of a lot of meat, chicken, fish, and potatoes, very little fruit, very little vegetables. Basically, everything I liked, I ate, but not vegetables or fruit. The first weeks I found really hard. I was really grumpy. I think it was in the third week I was thinking, if I don't get meat right now, I'm going to take a cow from the field, put it in my car, and throw it on the barbecue, because I'm so done with this. But at the same time, I was working towards a goal. For me, this was the last opportunity for my disease.
How are you doing now?
After week 7, I woke in the morning, and without thinking I stepped out of bed, and I thought, how is this possible? Because that normally takes me 5 minutes. And I moved my fingers and felt my knees, and I thought, what's going on with my body? Without almost any stiffness, I went down the stairs, and I get downstairs, and I say to my wife, I have almost no symptoms. What's going on with me? And like that, step by step, it kept getting better. Well, I can actually do everything again. I can work full time, I can put on my jacket, I can go for a walk, I can exercise. I can basically do everything again. And of course I have a setback once in a while, then I've gone a bit too far, and I need some rest. But the quality of life I've gotten back is phenomenal.
What do you recommend to others?
First of all, I hope Plants for Joints will be implemented in other hospitals, so more people will be reached through this project. And the people with rheumatoid arthritis, I would recommend to sign up for the program. But the people need to realize that you need to change your lifestyle. So it's not just eating a plant and tomorrow a piece of meat again. No, you really have to commit the full 100%. I got my life back with almost no medication, that with a vegan diet and the whole program. For the people at Plant for Joints, I am eternally grateful.
Well, I am really excited to have Dr. Dirkjan Van Schaardenburg, who is a special guest. He is coming from the Netherlands. I got a chance to meet him in August at the International Conference on Nutrition and Medicine, where he presented data from a study that he was intimately involved with, actually two studies called Plants for Joints, and both for osteoarthritis and rheumatoid arthritis. And this is so relevant as we talk about chronic pain conditions, because many with chronic pain conditions also have co-occurring arthritis, and many people with arthritis have these chronic pain conditions. So with that, welcome to the podcast, Dr. Van Schaardenburg.
Yeah, happy to be here. Thank you for having me.
Yeah. Well, before we dive into the details of what you shared and learned, can you tell us a little bit about yourself?
Well, I'm a rheumatologist that I first trained in internal medicine, and then I went on to rheumatology and did a lot of studies also as a researcher on early phases of rheumatoid arthritis. And then saw that many of these risk factors for this disease were similar to those of cardiovascular disease and so on. And that, in fact, much of the risk factors have to do with things that you can change, behavior things like lifestyle factors. And so we got interested in how we could affect those to try to minimize the disease activity in rheumatoid arthritis. So we did a trial on that. And then we added osteoarthritis because it's also so much metabolic disease. And so we did, in fact, 2 trials. And that's how we came on this Plants for Joints trial to try to decrease disease activity in both RA and OA. Has been my main project for the last few years.
Awesome. Thanks for doing that. How did you come up with the idea, or your group come up with the idea, that this might even be a possible successful intervention?
Well, as I said, by looking at risk factors for disease, and you see that many of them have to do with the environment or with lifestyle habits. And we are always working with medications to decrease disease. And so we thought we should actually expand this to include behavioral factors. And of course, movement, exercise has long been seen as a workable modality to treat patients with all sorts of rheumatic diseases. But there's much more to behavior than just exercise. It's also about nutrition and sleep and stress, and many more things add up to these conditions. And of course, it's difficult to study them separately or in combination, but I think we should try and start this.
You talked about metabolic factors. Can you elaborate what those are for listeners who may not be up to date on some of that verbiage?
Yeah, metabolism is the broad idea of what's happening in your body when you digest food. Then there are lots of products come from your gut into your blood system, go to the liver, and they are changed into substances that the body can use. And that's what we call metabolism. And this is also largely affected by the type of bacteria you have in your digestive system, in your gut. So this whole interaction between foods and your bacteria and your digestive system, including the liver, is determining whether you have a balance going more in the direction of inflammation or more in the direction of a quiet body that is more at rest, at peace, you could say. Yeah.
And what are the types of foods or environmental factors that shift more towards that inflammatory, unbalanced one?
Yeah. So if you look at nutrition, the major factors are saturated fat and trans fat ingestion. Salt also works in this way, and high glucose or foods that easily let out glucose so that you get glucose peaks in the blood is a factor. And in general, highly processed foods are inflammatory, pro-inflammatory factors. And in other areas, you can see that in the area of exercise is that the lack of exercise, just sitting around, hanging on the couch, is also promoting inflammation. Even if you're not doing anything, it's
Yeah.
promoting inflammation. And a bad sleep also promotes inflammation. So bad sleep habits also do this. And stress, many types of stress, it increases your cortisol hormone levels, which are bad. And it also works on the gut because there's these brain gut connections also are working in this way.
And you mentioned saturated fat. What are the foods that are the highest in saturated fat?
That's quite easy because mainly animal food is high in saturated fat. All animal foods have predominantly saturated fat and less unsaturated fats. And also many plant foods or plant oils are rich in saturated fats like sunflower oil or palm oil. Is also coconut oil is not so good.
Mm-hmm. So we've seen or recognized there's a connection between metabolic syndrome and so many other factors. We think of that as like diabetes and heart disease. Often we don't think about that as having any connection with the joints. And part of that is we haven't had a lot of intervention studies looking at the potential role food in particular has and lifestyle on the impact on arthritis. And that's where your study decided to take a more in-depth look. Before we dive into it, and you talked about this at the conference where you presented, there had been some studies that looked at the potential impact of food. Can you talk a little bit about that and then dive into what your study showed?
So what we did was not really new in the sense that people have long been thinking that the gut might have something to do with arthritis, although we didn't know how. And so there were even studies with fasting in the 80s. And the first real trial of food was published in 1991 in this important journal, The Lancet. It was a study where people in Norway, they were randomized by lottery. They got usual care, or they had first 1 week water fasting, then 3 months of vegan food, and then another 9 months of vegetarian food. During this whole year, the intervention group was better off with less swollen joints, less active rheumatoid arthritis than the control group. And it was a smaller study than ours, with 53 patients. But these are so intensive, these studies are difficult to do with more people. That's one of the things we notice now, that you have these drug trials where many hundred people are enrolled. And we do this with 80 people. And then they say we're doing a small study. So it's a bit uncertain what the results are meaning. But in this type of study, especially if you do multiple lifestyle factors, it's quite a challenge to do it with more people. Before you do a study, you make a calculation how much people you need to find the difference that you expect. And we were very well with our 80 participants. It's very clear that our effects are not just by chance.
And you
So that was
shared,
one big study, but there were more if you want to know about more of them.
or if you have the time, I'd love to hear some of
Yeah,
that.
there were several other studies. One good one was published in 2003 from Sweden. And there they said to rheumatoid arthritis patients that they could take a vegan diet with advice from a dietitian on telephone, or their usual diet like they were following. And they looked at the people after 1 year, and they saw that the vegan treated group had less disease activity, and they had not had so much attention in the sense that they were calling dietitians on the telephone, and they were helping them to follow this diet. And still, this is not easy, of course, but they had less disease activity than the usual diet group. So this was some. And then there have been a few studies of Mediterranean diet, which is more, also allows some animal foods and some red wine and olive oil. So it's, you could say it's a more relaxed version of the plant-based diet, is the Mediterranean diet, but it's more healthful than the standard Western diet. And these studies have also shown positive effects, although mostly they were quite small, these effects, but still significant. So that was the situation when we started.
Yeah. So tell us, I don't know which one you want to start with. One was I think the first one was looking at the role on rheumatoid arthritis, and then you had a second study looking at osteoarthritis. Can you talk about whichever one you want to start with?
I was talking about rheumatoid arthritis before, so I'll continue on that road. And we were looking whether we would do only a diet trial or also add in doing intervention on stress and sleep and exercise, because essentially, of course, diet is very important, but we wanted to do whatever we could, not using drugs. So it felt logical to combine these other factors. And we also looked at a study done in the US by Dr. Ornish with heart disease patients. And he combined in groups that people got practically plant-based diet in conjunction with exercise and meditation exercises and relaxation and social support. They came together in groups every week and showed that the heart disease rates went down in heart disease patients, and even their coronary arteries opened up if you did an angiography. And they showed this for a duration of 5 years. So this was long-term good results. So we thought, let's turn this into a modern intervention, also using online, WhatsApp groups and ways to connect people together in groups. So we said, let's go for the best diet. So the most anti-inflammatory diet we thought would be a plant-based diet, where we say, if you do it for these 4 months for 100%, and then later you can see whether you want to continue or maybe do it 80%. But we said, please try for these 4 months to comply completely and do a 100% plant-based diet. And most of them said they said afterwards it was possible. So that was one part. And the other part was that we tried to make them exercise more than they did. We have these Dutch guidelines saying that you should spend at least 3.5 hours every week doing moderately heavy exercises like brisk walking or running or cycling. And we also gave them exercises to do on relaxation, or spend time walking in the forest, or different activities that were possible. And we tried to make them increase the time they spent on such activities. So and in fact, we did, and we taught them how to improve their sleep. So on these 3 to 4 areas was where we mainly directed our activities. And then for 10 meetings, they came together once a week, at first in person, and then came COVID. And then we switched to completely online. So for the most people, it was hybrid. It was partly in person and partly later online. And the groups, some of them stayed together afterwards and they maintained their WhatsApp group and did things together. And then the others did not. So it differed. And we did just exactly the same intervention for the people with the osteoarthritis, because we were funded in part by the hospital. And the hospital said, we have a big rehabilitation department. There's lots of osteoarthritis patients there. So why don't you do more than just rheumatoid arthritis? I said, okay, certainly if this is a condition, we'll comply. And we thought it wasn't such a big problem because we just mixed these groups. We put them together in the same intervention groups, and this worked well. But it wasn't just any osteoarthritis. We entered people who had either in the hip or in the knee osteoarthritis according to clinical criteria of the American College of Rheumatology. And they also had to have this metabolic syndrome, because we thought if we take in patients who have osteoarthritis because of an accident, then it could be different. So we excluded those people and said they had to have this metabolic syndrome, for which there are also criteria. And that meant that the consequence was that the osteoarthritis participants, they had a higher body weight, higher body mass index than the RA patients. So that was a difference.
So what did you find?
Well, we treated them for 4 months in these groups once a week. And we gave them a lot of information, of course, and we also sent them messages and they could ask their questions and so on. So we really tried to have them change their behavior quite drastically these 4 months, and they complied very well. It went very well. And they also said, we never thought we could do this, but they did it. And then after 2 months, we did a measurement, and then after 16 weeks, so 4 months. And we saw that the disease activity in the RA patients improved after 8 weeks, and after 16 weeks, it was actually at the same level. And it was quite a bit lower than it was on average before we started. So this was a statistically significant result and also a clinically significant result, which means that the average improvement that the people had was actually what you more than the least what you would want to see by such an intervention. It was a bit like what you could see in drug trials, new drug trials.
Yeah. Looking at the study here, you looked at a number of different measurements in outcome, including this response in minimal disease activity called the EULAR good response at 8 weeks and 16 weeks. 3% had a good response versus only 8% in the non-intervention group.
Yeah, that's correct. So this good response means that either you have a large decrease in disease activity, although you still have some disease activity left, or you go into a state of very low disease activity, which we call remission. And so these add up, these two. And before we started, people had some form of active disease so that we could see the difference that would happen. And about nearly 50%, 45% or so achieved this state of very low disease activity that we call remission. And that was also a very nice result. Yeah.
Yeah, and then it also looks like the number of tender joints that out of 28 went from a baseline of 4.6 down to 1.8, so more than cut in half. On top of that, it looks like the C-reactive protein dropped from 4.3, that's a marker of inflammation, dropping down to 3.8 versus the actual non-intervention group. It actually went up from 3.4 to 4.8. So again, showing positive improvement in that standpoint as well.
Yeah, so all the measurements went in the right direction, although not all of them were statistically significant, but all disease activity measures went down. And then when you look at the metabolic outcomes, we saw that also body weight went down with an average of 4 kilograms, which was mostly the body fat. So people lost a little bit of muscle mass, but mostly fat mass. And their waist circumference also went down, which is important because, this belly fat is important in this metabolic syndrome. And also this LDL cholesterol, bad cholesterol went down, and the glucose values went down. So in several directions, there was improvement.
And a lot of people, when they think about going on a plant-based diet, often the big question is, well, where do you get your protein? Actually, looking at the study supports that you lost fat, and most people likely maintain protein. I know other studies have showed that if you maintain physical exercise and activity, that will maintain muscle mass and then lose just the fat mass. And as we've talked about, abdominal adiposity, that visceral organ fat, has been shown to be connected with inflammation. And that goes along with supporting the anti-inflammatory effect of the diet. There also is the DAS, DAS 28. I think that stands for the disease activity score, correct?
Right.
And
right.
talk about what happened in the intervention group.
Yeah. So this disease activity score has 4 components. It's general well-being, it's swollen joints, tendons, and the blood sedimentation rate. So the P or some inflammatory marker in the blood. And of course, these 4 components don't react all in the same manner. So what we saw, the biggest decrease was in the general well-being, then the tender joint count, and we had some less response in the sedimentation rate and swollen joint count. So the patient well-being was the factor that changed the most, which in the end is, of course, to patients the main thing. How am I feeling today? Do I have enough energy to do the things I want to do, etc.? Can I jump out of bed in the morning or not? So that one improved the most.
Yeah, and it looks like it dropped a little over about a point on a scale that started on average at 3.9, dropping to about 2.88 in the intervention group versus about 3.8, staying at 3.8. What is the average reduction? Now we live in the world of modern biological agents, antibodies that are out there for treating rheumatic diseases. What is the typical reduction you get with biological interventions?
And it's quite similar. So one of the first remarks I got from one of our fellow researchers who is doing a lot of drug trials, and he said, "Hey, this just looks like some drug trial." So this was quite similar to what you would see typically with a new type of drug intervention.
Yeah. And you said that most people attempted to stick with this. When you talked about the study with them, did you give them some of the information going into the likelihood or some of the supportive science showing that this might be helpful to increase their compliance rate? Were they informed or educated on that ahead of time?
What you have to do when you invite people to enter a study, you have to tell them what was already known on this subject. And so we told them about the earlier studies that had been done. And we said, well, we don't know how this will go in the era of these modern treatments, but we also see that these modern treatments don't make everyone feel good or healthy because some people still have disease activity or they have side effects. And we want to see in this group who still isn't in remission, can we improve their state? So when people hear this, most of them are interested to see if they can improve their state. But some, of course, are not motivated when they see what they have to do themselves to change the situation. So in the end, we ended up with a group who was highly motivated to work for at least 4 months on their lifestyle with all the support we were offering. Because, yeah, otherwise, if they wanted to do this, they would have to do it on their own. So this was for many people an option. And we also got people from far away who really saw this as an opportunity. So the group was more than average motivated.
Yeah. That's why education is so important, and that's why we try to do this podcast to give information to see that a lot of people aren't aware of this. What did you measure compliance of how many actually into any quartiles of adherence to the diet interventions?
Yes, we use this measurement that Dr. Ornish used in his heart disease trial. And he measured the amount of time that people spent on exercise activities and relaxation activities, which is, of course, subjective, but we asked them how much time they spent each week on these activities. And we asked them to fill in food diaries to see how these components of the food that were thought to be inflammatory or anti-inflammatory, how they would change. And what we saw was that, in fact, the level of exercise was not so bad. It was quite near the guidelines for exercise in the population. So it's good because most people are way below. And also relaxation time spent was not so bad and it did increase a little bit. But where we saw the most changes were in the diet. And we looked specifically at two factors, the saturated fat, which is ideally below 9% energy of the total energy amount in the daily food. If it's below 9%, the risk of heart disease and cardiovascular disease, like brain disease or arteries in the legs, that's altogether what you call cardiovascular disease. If it's below 9 energy percent, then there's hardly any cardiovascular disease. And we in the Netherlands, we recommend 10% to stay under the 10%. And the participants, they went down from 13 to 8% saturated fat on average, which is really beautiful. Very good result. And the fiber intake, which is also a very important part, went up substantially. It was not so bad because we say it's 13 gram per 1,000 kilogram fiber is the norm in the Netherlands. People were a bit under that, but they went up to something like 25 to 30 grams per 1,000 kilocalories food intake, and that's a large increase, very large increase. And in both these factors, we could see that there were the major changes, and people really were compliant with what we suggested them to do.
So within the diaries, was there, I know Ornish had shared in some of his studies, like less than 50% diet, 50 to 90 or greater than 90% within that. Are you implying that most of them were more than 90% compliant with the diet, or do you know, were you able to, 'cause I
Yes,
don't,
yeah, of course, this percentage is sort of an overall impression of how well people are adhering to the advice. And there's no real calculation of that, but it's intuitively people understand it. So what they say themselves that we were doing above 90%.
awesome.